Your PSA test just came back at 8, and your doctor looks concerned. In that exact moment, the room starts spinning, and your brain screams just one question. Do I have cancer? Before you panic, take a deep breath. Here is a medical fact that most men are never told: a PSA of 8 does not confirm you have prostate cancer. It is simply a signal. Statistically, according to the American Cancer Society, the vast majority of men who present with a PSA between 4 and 10 actually do not have prostate cancer. PSA stands for prostate-specific antigen. It's a normal protein produced by your prostate gland, not specifically by cancer cells. Think of it like smoke. Smoke means there might be a fire. But it could also just be someone burning toast in the kitchen. In Australia and the US, a PSA under 3 or 4 is generally considered normal, depending on your age. So yes, an 8 is elevated. It requires attention, but rushing into a panic, or worse, a blind biopsy, is a mistake that causes unnecessary harm. Let's look at what is actually happening. Before assuming the worst, you need to know about 3 very common non-cancerous reasons why your PSA might be 8. Number 1. BPH, or benign prostatic hyperplasia. As men age, the prostate naturally grows. According to the Mayo Clinic, BPH affects about 50% of men over age 50. A larger prostate simply produces more PSA, like a larger factory producing more goods. If you are waking up 3 times a night to pee, BPH is highly likely. Number 2, prostatitis, an inflammation or infection of the prostate. This can irritate the gland and cause a massive spike in PSA. In clinical practice, acute bacterial prostatitis has been known to temporarily push PSA levels up to 100. Number 3, mechanical factors. Did you ride a bicycle for 2 hours before the blood test? Did you ejaculate within the last 48 hours? Or did you recently have a urinary tract infection? All of these physically squeeze or irritate the prostate. Squeezing more PSA into your bloodstream, if any of these apply. Your first step is simply a repeat test under controlled conditions. However, a PSA of 8 cannot be ignored. Context is everything. A PSA of 8 in a 75-year-old man with a large, benign prostate is very different from an 8 in a 52-year-old man. Younger men have smaller prostates, meaning an 8 represents a much higher concentration of this protein. We also look at PSA velocity, the rate of change. If your PSA was 4 just 18 months ago and is now 8, that doubling time is a massive red flag, regardless of your age. Furthermore, if your father or brother had prostate cancer, your genetic risk is significantly higher. In these cases, an 8 demands urgent, specialized investigation. But here is the critical part. How we investigate has changed dramatically. 10 years ago, the next step was a blind biopsy, where needles were randomly inserted into the prostate, hoping to find the issue. Today, doing a random biopsy without an imaging roadmap is considered outdated. There is a much safer, smarter pathway. Welcome to the modern era of prostate care, the multi-parametric MRI. Before any needles go near your body, a high-resolution MRI scans the prostate. Think of this MRI scan like a GPS navigation system for your doctor. Instead of wandering around in the dark hoping to find the right house, the MRI provides an exact, crystal-clear map of the neighborhood. This technology gives doctors a PI-RADS score ranging from 1 to 5. The American College of Radiology developed this system to standardize cancer detection. A score of 1 or 2 means the prostate looks perfectly normal and benign. But a score of 4 or 5 indicates a suspicious area that needs a targeted biopsy. According to a landmark study in the New England Journal of Medicine, MRI-targeted biopsies detect up to 30% more high-risk cancers than random ones. Furthermore, research in the Lancet Oncology shows that using MRI first can actually help up to 27% of men avoid an unnecessary biopsy entirely. If a biopsy is needed, the doctor fuses the MRI images with real-time ultrasound, guiding the needle directly to the target lesion like a laser-guided system. Now, here is a secret most patients don't know. The total PSA number is only half the story. There are 2 additional calculations that change the entire picture. First is the free-to-total PSA ratio. In your bloodstream, some PSA floats freely like unattached balloons, while some is tightly bound to other proteins in the blood. While cancer cells tend to produce more bound PSA. According to American Urological Association guidelines, if your free PSA ratio is less than 10%, the risk of cancer is significantly higher. However, if that ratio is above 24%, you can breathe a little easier. The second critical calculation is called PSA density. Remember how larger prostates naturally make more PSA? We calculate density by dividing your PSA score by the exact physical volume of your prostate, which is measured during the MRI. Think of it like population density. 10 people in a tiny room feels crowded and suspicious. But 10 people in a massive mansion is completely normal. Research from Johns Hopkins Medicine shows that a PSA density above 0.15 is the critical threshold to watch. To truly understand prevention, we must look at what happens at the cellular level. Every day, your cells divide. Occasionally, DNA makes a typo, a mutation. Usually, your immune system's macrophages act like microscopic sweepers, destroying these errors. But what if a cell mutates to hide from the immune system? It starts multiplying recklessly. To grow, a tumor needs a blood supply. It releases chemical signals demanding new blood vessels. A process called angiogenesis, famously studied by Dr. Judah Folkman. This chaotic growth damages normal prostate tissue. Causing it to leak large amounts of PSA into the blood. But here is the empowering truth. Your daily choices can literally cut off this blood supply and support your immune sweepers. While aging and genetics are out of your control, chronic inflammation, the fuel. For cellular mutation, is largely dictated by what you put on your plate and how you move your body. Can we proactively protect the prostate? Absolutely. Let's talk about the power of nutrition. Specifically, a powerful antioxidant called lycopene, which gives tomatoes their bright red color. A massive Harvard Health Professionals follow-up study found an amazing link regarding prostate health. Men who consumed 2 or more servings of tomato sauce a week had a 23% lower risk of prostate cancer. But here is the critical trick. Eating raw tomatoes isn't enough. They must be cooked. Heating the tomatoes breaks down the tough cell walls, releasing the trapped lycopene inside. Adding a little olive oil helps your body absorb it, because lycopene is fat-soluble. Next is fitness, and we are not just talking about a light morning jog. Resistance training is crucial. Lifting weights builds muscle mass and targets the real enemy. That enemy is visceral fat, the dangerous belly fat that deeply wraps around your internal organs. This isn't just stored energy. Visceral fat actively pumps out inflammatory cytokines into your bloodstream. This creates chronic systemic inflammation, the exact fuel that mutated cells need to thrive. By reducing this fat through consistent resistance training and an anti-inflammatory diet, low in ultra-processed foods, you change your body's internal chemistry entirely. You transform your body into a very hostile environment for any mutated cells to survive. So, if your PSA is 8, here are the exact 5 questions you must take to your next appointment. Question 1. What is my PSA doubling time? Question 2. Can we check my free to total PSA ratio? Question 3. Do I need a multiparametric MRI before any biopsy? Question 4. What is my PSA density based on my prostate volume? And question 5. Considering my age and family history, what is my true risk profile? Asking these questions shows your doctor you are informed and engaged. A PSA of 8 is the start of a conversation, not a death sentence. Stay calm, demand proper imaging, and focus on an anti-inflammatory lifestyle. Take control of your health today. Warning, remember, this video is for educational purposes only. Prostate health is complex and highly individualized. Please consult a qualified urologist or healthcare professional. Before making any medical decisions, take care of your prostate.